Also hailing from the Big Apple, New York City, is Kate MacKenzie. Kate MacKenzie comes from the New York City Mayor's Office of Food Policy. Kate, I have to share with you, I've been looking forward to your presentation in particular. In the city's response for me, the spotlight of COVID-19 and how it responded to it, how the COVID-19 throughout the entire United States has really shown the spotlight on food insecurity, the food policies, not only in healthcare, but in governmental in every city and state, the ethnic, geographic, and economic disparities that we all have been facing. You guys were ground zero from the very, very beginning. How did you guys respond to that? I remember watching the long lines and seeing the long lines of the food banks that has been unprecedented ever before. Seeing many culinarians, the people on this line and their colleagues who went from working the line, putting food on plates, to standing in line to getting food themselves. So Kate, speaking with you today, I think is going to be important. And for the audience to understand that Kate MacKenzie, the Executive Director of New York City's Mayor's Office for Food Policy. Kate addresses the mayor on all issues related to food policy and the city's food system. She leads the city's good food purchasing program, purchasing commitments, focused on increasing access to healthy, sustainable foods for over 238 million meals and snacks served daily by city agencies, from public schools to senior centers, excuse me. Through this work, the city agency recognizes meatless Mondays and have reduced the amount of processed meat every day. Kate MacKenzie, please, I look forward to hearing your presentation today and really your important work that you're doing to improve the food quality and health and wellness in New York City.
Thank you so much, Carrie. We can go to the next slide, please. I am really thrilled to be here today to have a chance to bring some thoughts, some experiences, and also to learn from my panelists here and from the participants in the conference as well. My name is Kate MacKenzie, and I have the honor and responsibility of serving as Executive Director of the Mayor's Office of Food Policy under Mayor Eric Adams. Mayor Adams is really a food mayor. He brings his personal experience of reversing his own diabetes by using lifestyle medicine and following a plant-based diet. The Mayor's Office of Food Policy is thrilled about the mayor's interest and commitments to advancing food and nutrition policy. Under his leadership, we're committed to reshaping our food and health systems and making healthier and more plant-forward options more accessible to all New Yorkers. I imagine that everyone on this call knows that food is critical to individual, community, and planetary health and well-being. We believe that every New Yorker deserves access to healthy and nutritious food that tastes good. Under Mayor Adams, the city is committed to addressing the intersections between food, health, and climate, and ensuring that the city procures, prepares, and serves healthy and delicious food citywide. I'm going to talk a little bit about the role of food in our city government and highlight our 10-year food policy plan, and then finally give some specific examples of how we have integrated food and health into policy, focusing especially on our public hospital system. Next slide, please. First, a little bit, just a moment around the Mayor's Office of Food Policy. It was created with a mandate from the city charter to advance the city's efforts to increase food security, promote access to and consumption of healthy foods, and support economic opportunity and environmental sustainability in the food system. The office truly serves as an extension of City Hall, advising city agencies and deputy mayors on food policy, and helps to create innovation across city food programs. We look at policy and programs holistically It's not just about getting food to people, but it's thinking about how the health and the cultural appropriateness of that food is considered, or identifying ways in which businesses, especially MWBE food businesses, can be better utilized. Or we consider the role of food and the environment, which is particularly pronounced this climate week that we're currently entering. Next slide, please. New York City, like many cities, and even our federal government, is very complex and often siloed when it comes to addressing food policy, different programs and initiatives. The Mayor's Office of Food Policy serves really as the connective tissue across all of these distinct city agencies and mayoral offices. So you'll see here that whether it's agencies that directly provide food, or agencies that support our city's food supply, or those agencies and offices that provide oversight and manage systems like the law department. Each of these systems and structures has a role to play when it comes to food policy. Next slide, please. In February of 2020, the office created the city's first ever 10-year food policy plan to lay out a strategy for how we can achieve all of the things I've just mentioned. In February of 2023, we'll be issuing our first progress report on that plan. And much of what I will be discussing here is highlighted in that plan. Next slide, please. So let's just get a little bit specific here about how that we are integrating food and health into our city policy. Next slide, please. We spend, as a city, roughly $500 million a year on food purchases that ensure that students in our 1,100 public schools, in our 11 public hospitals, in our shelter system, in our correction system, and certainly in our senior centers, to name just a few, we provide the food and meals into those systems. To demonstrate our commitments to equity, health, and environmental sustainability, the City of New York has developed a rather ambitious yet achievable citywide strategy to adopt and integrate principles of good food purchasing. Executive action is a way that the city has to be able to formalize commitments and drive results in this work. Executive Order 8, signed on February 10th, was our first formal commitment to this work that Mayor Adams felt very, very strongly about. Next slide, please. Our meal standards. Beginning in 2008, city agencies have been mandated to follow food and nutrition standards for meals served throughout those city agencies. We update those standards typically every 3 years, and with the most recent updates happening in April of 2022. So to be clear, our Department of Health and Mental Hygiene and the Mayor's Office of Food Policy thoroughly interrogate all research and updates to make sure that we can continue to be the most cutting edge and progressive city to ensure that all of those 230 million meals that Carrie mentioned follow healthy and nutritious guidelines. Another reason for this is that we know that structural inequities make healthy eating challenging. And the goals of the updated food standards include increasing emphasis on eating whole and unprocessed plant-based foods, as well as reducing the risk of obesity, diabetes, and cardiovascular disease by improving dietary intake. This is strongly impacted by such inequities. The updated food standards also aim to keep the planet healthy by reducing beef and processed meat in terms of meal options. As part of these new food standards, individuals accessing meals or snacks served by city agencies will have food with less added sugars, lower sodium, a reduced number of beef options, and more opportunities to have a delicious plant-based protein. Additionally, sugary drinks will be removed from city vending machines. The standards being put into place follow very rigorous evidence-based nutrition criteria that all city agencies and their subcontractors must apply to the meals and snacks they serve. Next slide, please. So our public hospital system has really considered nutrition from many different dimensions, whether it's food access, food insecurity, nutrition and lifestyle, chronic disease prevention and management, and very clearly research and evaluation. We again consider all of these elements in a holistic way to make sure that the public hospital system thinks about food, not just when you're being treated, but also in ways that we can prevent disease in the first place. I'm going to highlight in the next slides a few specific programming options here. Next slide, please. So our Food Navigator program, this is really interesting, particularly when you consider the population that's served by our public hospital system. Individuals are actually screened for food insecurity. This is something that, I often say, it's one thing for doctors to be able to tell you to eat a healthy diet, but if you don't know where you can buy healthy food, maybe you need help connecting to an emergency food program. Maybe you need help participating and getting enrolled into government assistance program like SNAP or WIC. Maybe it's as simple as learning that your students get actually free breakfast and lunch in your city schools. This sort of offering of a Food Navigator program is a first moment to be able to identify ways and referrals for individuals to be able to get access to healthy food resources. Next slide, please. As I noted, it seems rather intuitive and obvious, but being able to ensure that we are actually screening and making referrals for food insecurity is important. Our health and hospital staff ask patients about their social needs, including food, during clinic visits. We also can create a closed loop referral system to prioritize social service organizations in specific neighborhoods based on where people live, so that they're accessible to them, they speak the same language, and they're a trusted community resource. Next slide, please. Notably, as I mentioned, Mayor Adams, as borough president of Brooklyn before he became mayor, really became a pronounced supporter and one who followed a lifestyle medicine program. The Bellevue plant-based lifestyle medicine program launched with support from Mayor Adams several years ago when he was borough president. The clinic was designed to help people get healthier by changing their lifestyle habits, especially their diet and nutrition. The program encourages patients to adopt a plant-based diet, and adults with the following medical conditions are eligible to join this program. Could be type 2 diabetes, pre-diabetes, heart disease, high blood pressure, high cholesterol, or overweight. Under the leadership of Mayor Adams, we will be seeing the expansion of this clinic into an additional 6 hospitals over the course of the next year. Next slide, please. I really have to say that our public hospital system is really embracing the full opportunities available through who they are as a system, as a recognized leader in New York City, as a trusted advocate, and obviously provider of health services, to make sure that they're also promoting a plant-based message. As Carrie mentioned, it was these public hospitals, as well as certainly our private hospital system, that were inundated, to say the least, around COVID-19. New Yorkers still turn to, and with even greater resolve and commitment to our public hospital system, and to know that they are championing both in inpatient settings as well as in the through prescriptions and other things. A plant-based diet is really remarkable and commendable. We'll only see this work continue to advance. And with that, I really look forward to answering your questions during the discussion and hearing from my fellow panelists. Thank you.
Thank you, Kate. And wow, I was really, as I said, really excited about hearing your presentation, and I'm really pleased to see the things that you guys are doing and have done. Just absolutely phenomenal. I think it all starts with not only your fine credentials and just your insightfulness, but Mayor Adams to have that type of leadership that says that we're going to make a difference, I think is just so commendable. And as New York can help, I think, provide directions for the entire country. Well, a couple of things that we're going to have Q&A later on, but just a couple of things I definitely wanted to speak about from just the good food purchasing policy. I just think it's just absolutely spot on, and it cannot be overstated. The meal standards, which is essential, but is so important. And then last but not least, was really important, the food navigator is really meeting people where they are, asking them questions, finding out where they are in food insecurity, and letting them know what the tools are that's made available. Hats off to you guys, is doing just a tremendous job. And I hope the other cities and states around the country start following your lead. And I look forward to working more closely with you. Thanks again, and look forward to our Q&A.